Hi everyone, my name is Megan Weisack. Thank you so much for joining me today for our lecture about central line maintenance. The purpose of this lecture is to increase the proper central line dressing change compliance among staff nurses to decrease the number of central line associated bloodstream infections, for short CLABSI, on the medical surge hospital unit. The goal is that the nursing staff will verbalize and demonstrate proper aseptic technique during central line dressing changes to decrease the CLABSI. So we will have a lecture on CLABSI bundle maintenance daily check, which is a policy that VCU Health has adapted, and I have sent you guys in an email in this sheet, so you can pull that up and we'll be going over that. And as a learner, you will be able to list the reasons that the checklist should be followed. Okay, so as we know, of all the healthcare associated infections, the central line associated bloodstream infection, they are the most costly for the hospital. And the risk of the CLABSI increases for patients with chronic illness, immunocompromised, malnutrition, burns, older adults, prolonged hospitalization, etc. So to improve the compliance with the dressing change standards and using the CLABSI bundle maintenance daily check, we can greatly reduce the incidence of CLABSI. So let's go over the hospital policy and look at the CLABSI bundle maintenance daily check handout, which has 7 important points. First one we start with is the hand hygiene. Hand hygiene should be done before you even touch the central line, which I know everyone should know, but just to reinforce it, hand hygiene. Before you enter the room, before you touch the line, as you leave the room. Hand hygiene, very important. Number 2 is assess the need for the central line daily. So we want to make sure we ask, do we still need the central line? And if so, document why do we need it? What's the necessity for having it? Number 3, use a chlorhexidine, which is CHG bath wipes once a day, and you want to wipe 6 inches of the tubing closest to the patient. Use a fresh wipe each time. This is very important with the prevention of the infection. And also, and you can delegate this, that the patients should have a CHG bath every day. Number 4, you want to assess the insertion site every shift. You want to look at if there's any redness, any tenderness, any pain, any drainage. Look at the dressing integrity. Is it intact? Of course, you want to change if it is compromised, if it is loose, if it's damp. You want to check the date on the dressing. The transparent dressings should be changed every 7 days, and the gauze dressing is changed every 2 days. Number 5, you want to look at the IV tubing. Make sure it's labeled also with the date and the time that it was initiated and with the expiration date. The continuous IV infusions, the tubing should be changed every 96 hours, and the intermittent infusions, you want to change those every 24 hours. Number 6, we want to use the Curus caps on all ports of the IV tubing and on all the hubs without an infusion going. Make sure you scrub the hub for 15 seconds between any changes, any injections. If you do anything, once you take off the Curus cap, make sure you scrub it with an alcohol wipe for at least 15 seconds. And in between anything that you do, always scrub 15 seconds with a fresh alcohol wipe, and make sure you don't reuse those curious caps. You always get a fresh one to put back on. And number 7, you change the needle-less connectors every 96 hours when they are removed for any reasons. If there is any residual blood or debris visible, you want to change those. Also, prior to drawing a sample for a blood culture, you want to change those needle-less connectors, and upon any contamination. So those are the 7 steps in the CLABSI bundle maintenance daily check that the nurse should follow every single shift to assess that central line. All right, thank you guys. And as I said, please think of the reasons why the checklist should be followed, and we will go over this when we meet again via our Zoom meeting. So next I will email you guys a video link to a 5-minute video demonstration on the proper central line dressing change using the aseptic technique. And once you have watched the video, you should be able to verbalize the proper way to change the dressing using the aseptic technique. And as I said, we will meet again via the Zoom app to have a group discussion and to have any questions answered about this teaching or about the video technique. So I will follow up with you guys via email, and I'll see you soon. Thank you so much for your time and watching.